Okay, now we're going to discuss disorders of the central and peripheral nervous system and neuromuscular junction. This is probably the most important of all the presentations I'm submitting, other than the one with children, that's important also. Central nervous system disorders, we have traumatic brain injury. It causes an alteration in brain function caused by an external force. We see this in motor vehicle accidents, falls. Um, Primary can be direct impact or focal or diffuse. Secondary is indirect consequence of the primary injury. So remember, secondary is always caused by something else. A focal brain injury is an observable brain lesion. The force of impact typically produces contusions. A closed brain injury, the head strikes a hard surface or a rapidly moving object strikes the head. The dura mater remains intact and brain tissues are not exposed to the environment. It causes focal or diffuse brain injuries. A coup injury is an injury directly below the point of impact. Counter coup injury on the side, opposite the site of impact, and contusions can cause epidural hematomas, subdural hematomas, or intracerebral hematomas. And this slide illustrates brain trauma. So does this one. And this illustrates where the different hematomas are, and they need to be evacuated. They're all dangerous and deadly. A focal brain injury is an open brain injury. So an injury breaks the dura and exposes the cranial contents to the environment and causes both focal and diffuse injury. Diffuse axonal injury is an acceleration, deceleration, or rotational forces, shearing, tearing, or stretching of nerve fibers, and the severity corresponds with the amount of shearing force applied to the brainstem. So it can be mild, moderate, or severe. The categories include a mild concussion, classic cerebral concussion, or mild, moderate, and severe diffuse axonal injuries. A mild concussion, immediate but transitory clinical manifestations. Confusion lasts for 1 to several minutes, possibly with amnesia. A classic cerebral concussion is a loss of consciousness for less than 6 hours, accompanied with amnesia and a confusional state lasting hours to days. Transient sensation of respiration can occur. A secondary brain injury is an indirect result of a primary brain injury, and this is trauma and stroke syndromes, and it can be systemic or cerebral processes. Management is related to prevention. Post-concussion syndrome can last for weeks or months. Post-traumatic seizures can occur within days, even up to 2 to 4 years post the injury. Seizure prevention is initiated early with moderate to severe TBI. So these patients should be on minimal stimulation, no TV, no video games, nothing that's going to excite their nervous system. Complications can include chronic traumatic encephalopathy, which is a progressive dementing disease. You see this now in football players and boxers. It causes dementia. Primary spinal cord injury occurs with initial mechanical trauma and immediate tissue destruction, and it can occur due to inadequate mobilization following the injury, and it can occur in the absence of a vertebral fracture or dislocation. L4 to S1 is the most common site of this injury. Secondary spinal cord injury is a pathophysiologic cascade of events that begins immediately after the injury and continues for weeks. It's life-threatening if the swelling occurs in the cervical region. These vertebral injuries most commonly occur due to vertebral injuries like a simple fracture, a compressed fracture, a comminuted fracture, or dislocation. A traumatic injury of vertebral and neural tissues as a result of compressing, pulling, or shearing forces. So you often see these in motor vehicle accidents or um, a traumatic injury, like being thrown off a horse. And this illustrates the spinal cord trauma. Here's another illustration. And again, and again. Spinal shock is when normal activity of the spinal cord ceases at or below the level of the injury. The sites lack continuous nervous discharge from the brain, and a complete loss of reflex function, including skeletal, bladder, and bowel, thermal control, and autonomic control below the level of the lesion can occur. Neurogenic shock occurs with injuries that are above T5. It's caused by absence of sympathetic activity and unopposed parasympathetic tone. Autonomic hyperreflexia, massive uncompensated cardiovascular response to stimulation of the sympathetic nervous system. Stimulation of the sensory receptors below the level of the cord lesion. And this is an illustration of autonomic hyperreflexia. Degenerative disorders of the spine. Low back pain. Most causes are idiopathic, degenerative disc disease. This happens often as part of the aging process. Herniated intervertebral disc is a displacement of the nucleus pulpus, and it usually is caused by trauma, degenerative disc disease, or both. It can cause pain and numbness and tingling. Cerebrovascular accidents or strokes. Increased risk with diabetes and hypertension. It's a leading cause of disability and the third leading cause of death in the United States. It's classified by ischemic, hemorrhagic, and associated with hypoperfusion. Cerebrovascular accidents can be transient. It's a neurologic dysfunction lasting less than an hour. It does result from an ischemic event. Thrombotic stroke is an arterial occlusion caused by thrombi formed in the arterial arteries, supplying the brain or the intracranial vessels. Transient ischemic attacks. Symptoms, difficulty writing and speaking, are suspicious of middle cerebral artery occlusion. And here we have some other classifications of cerebrovascular accidents, or CVAs. Cerebral infarction, that's caused by an occlusion. And there are ischemic and hemorrhagic, and we all know about those. We all have our stroke alerts in the hospitals. Hemorrhagic strokes, third most common cause of CVA. Hypertension is the primary cause, and bleeding causes compressed brain tissue, leading to ischemia, edema, increased intracranial pressure, and necrosis. Intracranial aneurysms can also cause these issues. And this is what some of the aneurysms look like. Cerebral vascular disorders, vascular malformations or AV malformations, subarachnoid hemorrhage, manifestations in Kernig and Brzezinski signs. You use those when you're looking for meningitis. Headaches, migraines. They can be familial, episodic. Um, the marker is a headache that's defined lasting 4 to 72 hours, and it's repeated. More common in women, and it can be caused by a combination of genetic and environmental factors. Usually, whoops, I skipped that, but I missed that. But usually they're one-sided, and they can have an aura. Triggers can be altered sleep patterns, skipping meals, overexertion. So there are a lot of different things that can cause migraine. Cluster headaches can last minute to hours or days, and these are more common in men. Um, and they occur in clusters. Trigeminal activation and autonomic dysfunction. Headaches are very debilitating in patients. Tension type is the most common type of headache, usually in the second decade. They can be mild to moderate, and episodes can last several hours or days. Meningitis. There are three different types of meningitis: fungal, viral, and bacterial. Brain and spinal cord abscess can be localized collection of pus within the parenchyma, extradural, subdural, or intracerebral. Progresses from localization or localized inflammation to necrotic core from the formation of a conductive tissue capsule. Clinical manifestations can be low-grade fever, headache, neck pain and stiffness, confusion, inattentiveness. Spinal cord abscesses. The clinical manifestations include spinal arching, severe root pain, weakness, and paralysis. Encephalitis is an acute febrile illness, usually of viral origin with nervous system involvement. The most common forms of encephalitis are caused by arthropod-borne viruses and herpes simplex virus. So mosquitoes carry encephalitis. Neurologic complications of AIDS. It can cause all sorts of issues with the neurologic system. Demyelinating disorders, multiple sclerosis is autoimmune. There are four subtypes of it. Guillain-Barré is an acquired inflammatory disease causing demyelinization of the peripheral nerves. Acute onset, ascending motor paralysis. Myasthenia gravis is an acquired chronic autoimmune disease affecting the thymus. Brain tumors. Primary brain tumors, gliomas. Posterior fossa is the most common location. Astrocytoma is the most common in children. Extracerebral tumors are here. Spinal cord tumors.